Welcome, Doctor. We are introducing a new phase for this session to begin, and she is the first time moderator for our English session today. Welcome, Doctor.
Good evening, everyone. Can you see me?
Yes, everything fine. Everything fine.
Okay. Good evening, everyone. The International Forum for Promoting Homeopathy, IFPH, is an international homeopathic humanitarian organization. Is formed to bring together the global promotion of homeopathy and to bring together homeopathic movements, activists, and activities worldwide under one umbrella. Today is our 1972nd day of uninterrupted daily webinar series. Thank you all for joining us here today at this program. We are delighted to welcome all the practitioners, lecturers, students, and well-wishers to this webinar. I am Dr. Sheila Prem, today's moderator. Today, our guest is Dr. Indraneel Bawadekar, MD Homeo, LLB, DMJFM, PG Diploma in Forensic Medicine, Homeopathic Nephrologist, now practicing in Narayanpet and Kodh Road, Pune, more than 31 years of experience, and he is well versed in medical laws, and he has taken more than 50 CMEs to doctors and students. Today, our topic is very interesting. That is miasmatic management of type 2 diabetes mellitus. We all know that type 2 diabetes mellitus is a very common condition nowadays. Why it is interesting? Because it is now he is narrating us the miasmatic management of type 2 diabetes mellitus. So let us welcome our guest, Dr. Indraneel Bawadekar. I think before also, sir already took so many classes here. So I think all are familiar with him. Anyway, sir, you are welcome. And now the dais is yours. Thank you, sir.
Thank you, doctor, for your kind introduction. And I'm very happy to talk on this topic today. Just a minute. I'll just share my screen. Is my screen visible to everyone?
Yes.
Okay. Thank you. I'll just... Yes. So, I basically would like to thank Dr. Sahani sir, Dr. Dinesh sir, Dr. Manoj, Dr. Sheila, and all the organizing team of IFPH for again inviting me over here to give a talk on type 2 diabetes and its miasmatic management. So I welcome you all. Friends, I am very much sure that each and everyone in our family has one or two people who have got diabetes. They are all comfortable because they are on conventional medicines and they are just happy with carrying on their lives. But to remove the disease from our roots, homeopathy can be, you can say, a supplement to them, or you can say complementary to them, which will definitely reduce down the conventional pill burden, and sometimes it will totally control the type 2 diabetes. So today I'll be focusing on diabetes type 2. Type 1 is a different one. I will be only limiting my talk to type 2. The topic is very vast. 1 hour is less, but I will try to complete as much as possible to give you good hints in your medical practice. So we'll begin. So friends, type 2 diabetes. Now, type 2 diabetes, basically speaking, is usually seen in elderly people. We see elderly after birth, that is nowadays it has come to 30 years. Previously it was said to be like after 40 years of age, but now it has come to 30 years. Now, type 2 diabetes mellitus, it is basically, we can say from Hahnemannian principles, it's a lifestyle disorder like hypertension, diabetes, or somewhat the metabolic diseases. So this diabetes is a chronic metabolic disorder. It is characterized by persistently elevated blood glucose levels resulting from insulin resistance, reduced sensitivity of the body to the tissues for insulin, and a relatively deficiency of insulin. So secretion by pancreatic beta cells. We know the pancreas are the organs which basically stimulate that like beta cells, they secrete insulin, and whenever the sugar rises in the blood, a stimulus is given by the body to the pancreas to release the insulin and to nullify the sugar. So like the beta cells are the main islet of Langerhans. It is called who manufacture insulin in our body. So like this disturbance is basically responsible for type 2 diabetes. Now, because of the deficiency of insulin secretion, sometimes over a period of time, they get worse. The pancreas, they get exhausted and patient lands into hyperglycemia. Now, friends, hyperglycemia is a state where in normal conditions, those who are diagnosed as first diabetes patients, mostly they are not aware that they are having sugars. And in their routine day-to-day life, with their chronic symptoms like weakness or general lethargy, they feel this is normal due to age because of after 40 years of age. And slowly, the disease itself puts its roots deep into our body and it affects the entire body. So one should know whether he is diabetic or he is a pre-diabetic or not. Now, in type 2 diabetes, in simple words, we can say that the body produces the insulin but cannot utilize it effectively and later may not produce enough insulin to maintain the normal glucose level. In very short, I will be describing the pathophysiology because this pathology physiology is definitely given in all books. We are aware of it, but I will just slightly revise it. What? Yeah. Now, what is the definition from homeopathic point of view? From homeopathic point of view, there is no book definition for diabetes mellitus. Basically, what from our organ on knowledge, we can say that it's a disturbed vital force and assimilation of body gets disturbed. This is a basic thing. In type 2 diabetes, we see that there is a resistance of insulin and plus relative insulin deficiency. First, there is a resistance, and also because of the resistance, there is insulin deficiency. I will come to it, why this occurs. Now, this is a very gradual in onset with constitutional background. It is said that whenever a patient gets diagnosed to have early type 2 diabetes, usually it is considered from that day he is diabetic. And the patient for the whole life, he calculates the years of diabetes which he had, 5 years, 10 years, 15 years, but it was from the onset. He remembers the date. As we remember our birth date, they remember the date or the year from when they got this diabetes diagnosed. But friends, gradual onsets with a constitutional background, it means a little bit different one. Now, books it is said with that 10 to 12 years, sometimes 15 years, the process of controlling sugar in our body is slowly lost by our human body because of disturbance in the vital force. Of course, everyone has a different constitution. So this constitutional background is responsible behind this hyperglycemia, and it takes around 10 to 12 years to manifest as an active or a permanent diabetic type 2 type of personality in a person. So the onset is very gradual. Now the etiology of this, say exact cause is unknown. Like you can put fingers on many points and say that these are responsible. Now there are certain predisposing causes. Now what are they? Family disposition. If our parents like mother, father, grandparents, if they have this disease because of the genetic predisposition, even though we are not obese, we are going to suffer from this. There are chances of around 90%. 10% people can escape this. Obesity. Inactivity. Obesity, I mean central obesity, where we have a pot belly appearance and the fat accumulates in the abdomen more. You can say a Thuja patient, roughly. All Thujas are not diabetic, but like a Thuja-like personality. Now, inactivity. Normally, what happens because of the modern lifestyle, that the activity physical goes on down. Now, people go for a short distance, they take a two-wheeler and they go. They go for small work, because of time factor and comfort, they, forget walking exercises. And their physical activity is very less. Even now, mobiles have brought down the physical activity very less. If you want something from a shop, we just order it. Previously, we used to go to the shop and get it. So this physical activity also is contributing a predisposing cause. There is a maturity onset diabetes in young age, which is called as a MODY, M-O-D-Y. What is young age? That is 30 years plus. Because 30 to 60 is a middle age, and after 60 we become senior citizens. That is a basic observation. It is not a rule given anywhere. The government rules for age being senior citizens are different. Now, secondary causes are there. Say endocrine disorders, any endocrine disorder. Let it be thyroid, let it be adrenal, Any disorder can basically cause diabetes. Chronic pancreatitis. I'm not going to the causes of it, but alcoholics are there, even non-alcoholics are there. Drug-induced pancreatitis are there. So because the pancreas are affected, they are very delicate and small, situated behind our umbilicus, little bit above, below the stomach and small next to the small intestines, we can say they get exhausted very fast or they get disturbed very fast. And sometimes malignancy is given in books, but rarely I have seen malignant pancreas. It is one, we can say 50 also. But the pancreatitis is a post-viral, many times it is seen. Post-viral diabetes have been seen in patients. Hematochromatosis, that means destruction of pancreas due to excessive iron accumulation. This iron accumulation is a disease, different. I am not going in that. So such diabetes is called as a bronze diabetes because of the iron destruction. Everything becomes bronze-like color. Pregnancy-induced diabetes, which is called as gestational diabetes, we all know it. Whose parents are diabetic, the daughters usually are prone to get only during pregnancy, and this goes away after the delivery happens. But a word of caution, I have seen in many patients that after 10 years of delivery, probably it again comes back and manifests as type 2 diabetes. Classification is a different one. My left hand slide is of type 1, second is of type 2. The figures I will not go in detail. We can just see only the pancreas, the insulin cells at the cell and the insulin's blue colored dots. These are the insulin released. And you can just see that here downwards, the glucose basically is inside the cells and this insulin makes an opening where it can enter the cells and give entry to the glucose inside the cells. This is just a diagrammatic representation. Now, type 2 diabetes. Now, it is a state of insulin resistance. This word nowadays we have heard many times. Insulin resistance, insulin resistance. Many homeopaths or say many doctors have mistaken it. Resistance means for these patients, insulin is not working. So one of my junior doctors asked me, sir, people take insulin injection, but there is no use of his injection. So are we supposed to call them as insulin resistance? So we should not take the word meaning. Insulin resistance means a different one. We'll shortly rush through it. Okay. Initially, the insulin levels are raised after passing of years in the blood. Why they are raised? Because once the body starts controlling the controlling the sugar levels in the blood, the insulin is produced by pancreas. And as per the demand, usually insulin is produced, but sometimes the level remains constantly high in the blood vessels. So pancreas keep on producing insulin just to nullify it. So that's why initially the levels are raised. After a few years, the pancreas beta cells are very vulnerable. They get exhausted, and there is failure to produce insulin also, either reduced or failure. So this type thing occurs, and patient has to depend on insulin forever. Now, this moody diabetes, only a word about it. It is a HLA linked because human lipoid antibodies, these are linked genetically, and because of that, early diagnosis or you can say early manifestation of type 2 diabetes is usually seen in our generation now. Now, clinical features, the books have given us polyuria, polydipsia, polyphagia. Sometimes patients feel these symptoms as normal symptoms. After 40 years of male patient, if he gets up at night 3 to 4 times, he thinks it is normal. In rainy days, in cold days, there is a frequent urination. So they take it as normal and it is sometimes missed. Even polyphagia is there, polydipsia is there. So like excessive thirst is there because the body is getting dehydrated or because of over urination. So excessive thirst is there. And then immediately gastric emptying because of the high sugar levels, the patients they get their food immediately passed further in the small intestine, and many patients have gastric emptying after 40 years of age. They tell us, sir, I had lunch at around 2:30. At 4 o'clock again, I was tremendously hungry. So this is due to the gastric emptying, and this occurs because of the uncontrolled blood sugars. So friends, this is a warning sign, either they're diabetic or they're in pre-diabetic phase. Now, many a times, in spite of having good appetite, in fact, some people self-medicate with all supplementary medicines like vitamins, omega-3, the market is flooded with it. Still, they feel weak. They feel tired. And after some years, the obese patients, without doing any exercise, without doing any special thing, start losing his weight because he loses his fats in the body. So that's why this weight reduction goes on. We call it as catabolic phase in the body. Now, this weakness, why it is there? Because the insulin, whichever is produced, it does not, in the say, I'll just go through a diagram afterwards. It does not allow the glucose to go inside the cells. So the cells are weak in energy of the body cells. And hence we feel the patient feels very weak because of the less, you can say, glucose in them. Now, many patients present with constipation, they take it as their constitutional symptom. But friends, constipation is one of the sign of type 2 diabetes. Everyone should keep in mind. Pruritus, we all know pruritus is there, burning fits with numbness. In males, we have seen after 40 to 45, there is impotency, and they think that it is because of the age, but it is not so. Females also, there is loss of libido. They mistake this as a part of menopausal age, but it can be an early sign of type 2 diabetes because high sugar levels can cause loss of libido, even impotency is also in males. Now I'll come to a short point, that is the insulin resistance. Now, in simple words, we will understand it. Books have given it. There are lots of people, all the MD physicians talking about the insulin resistance. But practically, what is it? Now, insulin we know. Now, insulin is a hormone that helps the sugars to move from the blood into the body cells for energy. So, our blood vessels, they carry, like high sugars and they have to enter the cells. So, to make them entry into the cells, this insulin is responsible. So, it is a hormone which moves the sugars from the blood into the vessels, cells. And when they are deficient, it doesn't reach. So, weakness is a common symptom in diabetes. Usually, homeopaths are prone or tempted to give acid fast for all diabetics, but in some patients they work, sometimes it doesn't work. We should understand the pathophysiology first. Now, what is the resistance? In insulin resistance, insulin is there, but the body cells, they do not listen to it. Sugar stays in the blood instead of entering into the cells. So the blood sugar rises, but it never enters the cells of the body. Even insulin is also there, but it doesn't, allow these sugars to enter the cells of our body. So that is called as insulin resistance in simple words. I'll give a simple example. Like suppose, we have a key. Like insulin is like a key, and the cell is like a door. We open our doors with the key. In insulin resistance, the lock means the door lock becomes rusty, and that do not work. So our key does not work to open the door. So the same happens that the insulin rises, sugar rises in the vessels, but to make entry of this sugar inside the cells, the door does not open, and hence it is called as insulin resistance. Now, what will happen if the patient develops type 2 diabetes or is already on a way to develop a type 2 diabetes? So, like in initial state, there is a weight gain which is seen in patients. They start becoming chubby after 30, 35 years of age. Maybe all the modern food lifestyle, no activity, physical activity, too much of refined sugar food. This refined sugar and food means does not mean pastries and cakes all the time. See, all the things which normally are consumed, like the cakes, the pastries, the biscuits, they all have refined sugars. We don't know about that. And it's a big industry, and we all are loading our body with these refined sugars. So that they are also responsible for excessive weight and obesity contributing to type 2 DM. Stress factor. Now, competition, like earning money, getting higher positions in a job, then going top and going to abroad. All parents usually think of their children to go abroad and settle. And nowadays, we can say because of oversaturation, job insecurity, all this stress causes the severe load on pancreas and our all metabolic system, and it is also responsible. Family tendency, I already have talked about it. Now, all the above things, if they continue, what happens? Body makes more insulin. Whenever there is more sugar raised in the blood, more insulin is made. Pancreas get tired by manufacturing insulin. Blood sugar rises permanently after few years. And as told you, because of resistance, insulin also demand of the body is increased and the pancreas get tired. And sometimes there is failure of beta cells. Some warning signs we may receive. Some patients, they do not receive these signs. They are accidentally diagnosed as type 2 diabetic. Because of any surgery planned, they are accidentally diagnosed, or they go for routine checkup and they get it diagnosed. Now, common signs are feeling tired, increased hunger, I told you, weight gain, dark skin around the neck and the armpits. There is hyperpigmentation near the neck and the armpits. The skin becomes very dark. So these are the normal signs. So important message is type 2 diabetes starts year before diagnosis. and insulin resistance. Now just go rapidly, I'll go through this diagram. Look at the diagram. In this diagram, the left side is the pancreas. I told you the pancreas basically, yeah, are below the stomach, we can say. And with my arrow, I'll show you. Now this is a body cell. If you can appreciate this small line of arrow, here you can see that inside the cell, these are the two lines. The blue one basically is an insulin and yellow one is of glucose. Now, whenever this glucose rises, the body manufactures more insulin. They start accumulating over here, and this is a blood vessel basically. And from this blood vessel inside this cell, the glucose should reach. So this the part should open and it should reach, but they do not open. In type 2 diabetics, it happens in this way, and hence there is increase in blood sugar levels, which we already saw just now. The glucose levels increases, even insulin level increases. The second diagram will show you that this is a body cell. This is the circulating blood and the insulin receptors. These are called as insulin receptors. See, they were opened over here, and this arrow will appreciate you that there is a way of this thing glucose to enter our cells. And this balance is maintained because of the insulin. And this closing and opening of doors is called as insulin resistance. Now, because of high sugars going on for long time, what happens? There are two types of complications. We usually see in our elderly people. There is a micro and macro. So this relates to blood vessels. What is macro? Means a large blood vessels in the body. Sometimes even large means more than 1 mm, we can say. In the heart, the coronaries are there. They may get coronary heart disease or any type of heart disease. In the brain, there can be a stroke. There can be ischemia or dementia. And sometimes because of the poor circulation, claudications, gangrenes in large vessels, it is seen because of the large blood vessels getting over accumulated of glucose and fat, and narrowing happens. Now, microvascular combinations are the small. In our eye, there is retina, we all know. So the retina sometimes bleeds. Sometimes the retina gets extra growths over it, and retinopathies may get developed. The nerves may get damaged, and we can get neuropathy because of high levels continuously in the blood. Kidneys, we all know. Now the incidence is very increasing, and kidney disease basically manifests after 10 to 15 years of being diagnosed as a diabetes. It may vary, because this is a general observation. Kidney disease may vary. Somebody may get it after 5 years, somebody may not get after 20 years. Now, why homeopathy we should think in type 2 diabetes? I'll tell you. Now we'll come to the homeopathic point of view rapidly. See, not only sugar control is not diabetes curing. Constitutional and chronic miasmatic disorder is behind this all diabetes mellitus. Your lifestyle, hereditary emotions, they definitely play a role. Giving a few doses of medicines and everything is over, we cannot say that because this is a lifestyle disorder. We have to control the lifestyle as well as give our homeopathic medicines. So we should focus on the cause, constitution, and the complications. Now, when the patient has come to us is very important. A newly diabetic is a different one. Then already 5 years of diabetes is a different patient. And with diabetic, all micro and vascular as well as macrovascular complications, if the patient comes to us, this is a different case. So friends, miasm is important. Only collecting the symptoms, making totality, matching it with our material drug picture and giving medicines, it works, but it works temporarily. And if we are aware of the miasm or the seeds of the disease which are there in the body in the form of miasm, we can definitely manage more well, and we can prevent the further complications of this disease, which are seen in everyone who have got type 2 DM. So now we'll see the miasmatic concept. Type 2 DM, basically it's a miasmatic disease. It's slow in onset. I told you, multiple organs get affected, and a homeopathy makes the correction of the vital force, which is disturbed. So vital force is disturbed, we all know, and homeopathy makes a correction in it. Okay. Now the interpretation of type 2 DM. What is a homeopathic interpretation? Say in homeopathy, we do not understand that, that this high sugars or diabetic, so give a blanket treatment. We do not give value to the sugars. We give to the constitutional disorder. That is very important. So in homeopathy, type 2 DM is understood not to be merely a disease of high sugar, but as a constitutional disorder. Disturbed vital force, we know it. Impaired metabolic assimilation. Then functional weakness of the organs like pancreas, livers, and endocrine system, because pancreas get exhausted. liver, the fat gets also exhausted and it improperly manufactures the glucose, sometimes less glucose. So neoglucogenesis and sometimes less. So all the major organs, they get exhausted. The disease reflects a deep-seated constitutional dyscrasia, often developing slowly. It is very slow developing. Long-standing faulty lifestyle, I already have talked. Mental stress, we have talked. Hereditary predisposition, which I have talked. The symptoms we know. PPP, polyuria, polydipsia, polyphagia. But sometimes they are not there. Accidental diagnosis of type 2 DM is also there. Obesity, recurrent skin infections. I've seen that recurrent boils in patients and vulvovaginitis. This is seen in pre-diabetics more. A delayed healing are viewed as an expression of the internal imbalance, not isolated with local complaints. It is said that there is delaying healing, but practical, my experience for more than 30 years in practice is that usually in middle-aged diabetic patient, when they develop type 2, their healing is very proper. They don't have delayed healings. Probably because of the old age, where there is narrowing of the blood vessels, peripheral blood vessels, probably the healing is delayed and gangrene is seen. But young patients, they do not have delayed healing, is my observation. Probably it may vary statistically. Now, miasmatic classification, we'll see it through the table wise so that you can get some idea. We know SORA, syphilis, and psychosis are the basic miasms which Dr. Hahnemann has also come to conclusion after his 30 years of practice, where he saw there was a recurrence of complaints. The patients were getting partially relieved but not cured. So the theory of chronic diseases came and we came to know about this. Now, a psoriatic diabetic, because normally we should, as a homeopath, talk boldly that a patient is diabetic, but he is what diabetic? Is he psoriatic? Is he syphilic? Or is he psychotic? This will give you more accuracy in the prescription, because giving a psoriatic remedy to a psychotic diabetic will partially work and never help. So slowly your faith and your patient's faith both will go down in homeopathy, I'm sure. So we should understand this. Now say SORA. SORA it tells us about the functional disorder, and that is the initial state of the disease. Characteristics in diabetes, we see that there is a disturbed metabolism, body metabolism disturbed. Insulin resistance without any structural damage. There is no structural damage in the body. Patient, what symptoms he may get initially? Psoriatic patients, they may get fatigue, weakness, polyphagia, polyuria, dryness of skin, which is normally treated as, dry eczema or contact dermatitis, but the underlying diabetes is there, we forget it. Then also anxiety about the health, these are there. So like these anti-psoriatic remedies like sulfur, calcarea, lycor, nitrum, they usually are indicated. Different remedies also they pop up, but these are frequently indicated in psoriatic state. In psychotic state, there is a proliferation and excessive state in the body. So hyperinsulinism. So we see that the fasting insulin of the patients, it comes a little bit high. They go psychotic, that is a predominant. Then there is a metabolic excess, fat deposition. Patients also develop hypothyroidism. I have seen psychotic. There is a fatty liver seen, fat deposition. Abdominal fat is there. Central obesity, because leading to dyslipidemias and recurrent infections. The psychotic patients, they cannot tolerate cold. I have seen in my practice. They are very sensitive to cold. So mostly chilly remedies in homeopathy are more than hot remedies, if you can observe. So common remedies are thuja, medorenum, netum sulf. These are the common psychotic remedies. There is list of remedies, but these are the basic ones which are indicated. Syphilitic miasm. It's a destructive miasm, we know it. There is a tissue degeneration and there is irreversible damage. Like, irreversible means it cannot be reversed back, the damage. Once damage, unfortunately, in this life, we are not going to get back. Suppose the eye is lost because of diabetic retinopathy. Maybe a proliferative or a bleeding one, but the vision cannot be restored. Nephropathies. Once the patient develops nephropathy and more than grade 3 of renal disease, it is not in our hands. Non-healing ulcers and gangrenes. What are the common remedies? Mercury, syphilium, arsenicum, sickle core, these are all deep acting remedies. Tubercular miasm is seen in many patients where there is alternating unstable state. So fluctuating sugars. Morning comes to 70 to 80, postprandial 300 to 400. These are tubercular miasm. They easily feel exhausted because of these fluctuations. There is a weight loss and weakness because of polyphagia, no appetite. Polyphagia, no appetite. They go in this stage. And also they are mentally also restless and because of their disturbed metabolism. Common indicated remedies are, silicia is there, phosphorus and tuberculinum. So this is a chart will explain you a little bit about the miasms. The soric miasm, functional state we saw it. We will just rapidly revise this. That initially insulin resistance is seen in when there is a miasm sora underlying. Okay. Fatigue and weakness are all functional symptoms. Occasionally headaches also patients may get, but the BP is normal. Increased appetite because of the gastric emptying. Dry skin, in spite of having plenty of water and also hydrating the proper taking care, there is a dryness and itching. Usually females take it, it is a menopausal state. So like this dryness is because of that. Of course, it is due to that, but psoric miasm predominates this state. Now, these patients, mentally, they have anxiety about the health. They represent the functional derangement. There is no structural derangement. So, anxiety about why this is happening with me. अभी तक ऐसा हुआ नहीं, so ये क्यों हुआ? Why I'm feeling like this? So they will always come and ask the doctor with their all list of questions. So these are psoric patients. Psychotic phase is a proliferative phase. We all know excessive state. Like we saying obesity, or you can say the sumo wrestlers. Usually I say they are not diabetic, but we like the obesity like that. It happens in the body. Then hyperinsulinism is there. Insulin is produced excessive, so the fasting insulin as well as postprandial insulins are high. Fatty liver disease, which is non-alcoholic fatty liver disease, is a psychotic state. Raised triglycerides in here in Maharashtra, each state differs. People are prone for hypertriglyceridemia. So all lipids are normal, only triglycerides are raised, and they're just put on some other conventional medicines and diet and lifestyle. But the miasm here we should consider as psychosis. It indicates overgrowth, accumulation, and metabolic excess. So, like in this state, all the blood vessels, macrovascular, then microvascular, they all usually get affected, and there is accumulation of all the waxy-like thing in the vessels, and slowly, there is narrowing and all stagnation occurs in the body. Syphilitic phase. This is the destructive phase. Neuropathy, burning feet, nephropathy, so altered renal parameters, then sudden blindness, then retinal veins and arteries thrombosis, or all retinopathies, non-healing ulcers because of the loss of blood circulation, gangrenes, sexual dysfunction, where there is a complete loss of erections in males and loss of libido. Then also in females we have seen that recurrent infections, and there is slowly tissue destruction, and which is irreversible. So in such cases the patient has syphilitic manifestation that we should keep in mind. A word about tubercular, which I have not mentioned here, but tubercular miasm also manifests. I have seen many patients having females, especially at menopausal age, having UTI going on. Sometimes the cultures are negative, no growth, but the pus cells are between 20 to 30. They are having chilliness. They are having weight reducing down. So many tubercular patients also manifest with recurrent infections that I have seen in my clinical practice. Now, what is a therapeutic homeopathic approach? We should keep this in mind. There should be an individualized constitutional remedy based on the totality. See, there is no blanket treatment available. I have seen in practice people giving certain drugs frequently. Cesium, jambolicum, uranium nitrate, and many drugs, they are biased with these medicines. And shortcut is there, so they give the medicines, but they partially work. They don't help the patient. Something happens, something good happens, patient, doctor is happy. If something doesn't happen, doctor also loses his faith in homeopathy. Now, antibiotic treatment to be addressed from the root cause. We should study the cause and the roots where the miasms are there, or the seeds of the miasms are in our body. Supportive organ remedies like pancreas, liver, kidney, they can be indicated, but they are not permanent. Sometimes the disease is very advanced pathology. So organ remedies can be used in a homeopathy like approach along with miasmatic approach. Lifestyle and dietary regulation as auxiliary measures is a must, because only giving dynamic medicines is not going to help the patient. If the patient fails in his lifestyle, simple diet regulations, the patient is never going to get control of his sugar levels, even though we give the right indicated remedy. So this we should understand in mind, and we should ask the patient to follow meticulously to have good results. Now, clinical pulse, we can say. When such patients come to us, first we should think of the constitutional remedy. Organ remedies as a second. Never give organ remedies, organopathics immediately. Yeah. Avoid long-term symptomatic use without miasmatic correction. Sometimes what happens, the patient comes to us. I'll give an example. It's not true for everyone. You give him a natramur. ailments from grief, somebody's loss of a relative. Sometimes you give ignatia also. The patient feels better, levels are less. In the second prescription, usually a homeopath makes a mistake. So now either to repeat it or to stop it. If you repeat in slow potency, the dynamic drug, you are overdosing the body. If you stop it, the body's support of dynamic medicine is gone. So what to do? And sometimes the drug keeps on, we keep on collecting the symptoms. Suppose 5 symptoms were there, now 3 are gone, 2 are remaining. So patient go on continuing. But unless and until the miasmatic correction is there, we are not going to get permanent results. So monitoring of glucose is also important. Sometimes patients tell us, Doctor, I'm fine. Your treatment, they praise us also. After your treatment, my weakness is gone. I'm happy now. But the glucose they do not do. And last figures which were normal, whenever you ask them, they tell us the lost normal figures. And they try to convince us that everything is all right. So we should explain them. Our regular monitoring is also important. Now, diet, exercise, all things are important. Like it's a team, of all these things which is going to help the patients. Mental state is also an integral part. If suppose somebody is under stress and we are giving all proper things, the stress also should be reduced on because mind is the headquarter. Dr. Sehgal sir has said, and it controls the body. So, like mental stress has to be addressed. Never forget in a patient or whenever you want to treat him miasmatically. Now, constitutional remedies, we saw that organ remedies, second, this I already told you. Avoid long-term symptomatic use of medicines. Regular monitoring glucose, I told you, diet, exercise, mental stress should be controlled. Now, some common miasmatic remedies table, I'll tell you. So it can be a different, but in general, I'll tell you, suppose a patient is soric. Then these remedies like sulfur, soranum, calcarea carbonicum, natrum, lycopodium, phosphorus. So polygress, they lead in soric patients. Also, some polygress study in psychotic patients, whereas overgrowth around thuja is there. Intercurrent medorinum as a nosode is there. Natrum sulf is there. Kali sulf, sabina, causticum, natramur, medorinum, thuja, acid nitric. These are all, APs. These are all, middle-age remedies for middle-aged patients. In case of syphilitic manifestations, where I told you there is a severe damage to the body, Merxol, arsenicum, syphilinum, aurum, nitric, kali iode, merc iode, plumbum, and fluoric acid. Now you can see that other remedies are also indicated, but these are some common remedies as per the miasms, which we should keep in mind. Suppose a patient is having suicidal tendency, aurum will dominate. It is a syphilitic manifestation. Now, some key remedies with some symptoms which you can so every time the full materia medica is not necessary. Or for diabetic patients, along with these all his history, we should consider some symptoms which are alarming for us to give the remedy. Suppose the patient is of sulfur, then you should understand that he's a psoriatic and he's in early stage of type 2 diabetes. Skin complaints are usually concomitant with all the sulfur patients. They have increased appetite. So the patient in initial stage, Dr. Bhuk bahut lagti hai. That is polyphagia. So we should know that the sulfur should be the remedy. Calcaria carbonicum, we see an old patient who has got a sensitivity to cold climate. Excessive sweating, constipation, sweating over the head, back. We see many such patients. School going boys and girls also have seen of calcaria nowadays. In lycopodium, always we can see that whenever you want to give lycopodium, there should be flatulence of the lower abdomen. There is a craving for sweets and liver affections. Liver affections can be any, right from functional to structural affections. So you can think for lycopodium. Natrum sulf, where there is a fatty liver, damp aggravations, liver and pancreas axis involvement. So liver as well as pancreas, both are disturbed. You can think of this. Thuja, where there is a DM with long-standing obesity, like say of vaccinations, because of after COVID, many patients of type 2 DM have increased. And probably, I don't know, I'm not blaming the vaccines, but the incidence has increased. So we have to manage them now. So like many a times Thuja is indicated. Acid phos is also given when there is a mental exhaustion and prostration. People mislead acid phos for physical weakness, but it should be for a mental weakness where there is an ailment of grief behind it. Arsenicum alabum is a big polycrest. So for all things where there is burning, chilliness, neuropathy, we can use it. Uranium nitrate has got excessive sugars in the urine, 4 plus, 3 plus, thirst and emaciation. In initial stage, you can use it. And Syzygium japonicum is supportive. I will tell you this helps. These mother tinctures are used in practice by many learned homeopaths. but it helps you as a supportive. It will never cure. So we should keep in mind. Now I'll go to a case study rapidly so that you can get some idea about the miasmatic prescriptions in some cases. There are many cases, but this is a demo case for you, so where you can get an idea. Now there was a male who had an age around 42 years old. His occupation was a office worker. He's a sedentary worker. He's having personality like obese personality, big pot belly, stomach, central obesity. And in family history, the mother was not having so much. His father was diabetic, and he was also type 2 diabetic, his father. Now his complaints were for around 3 to 4 years. Now, what were the coming complaints over here? He says, "Sir, there is excessive thirst and urination." It was nowadays actually yet in Maharashtra some cold season is there. Urination is more in cold season. We agree, but why thirst? People are usually thirstless in cold and rainy season. But he complains that I have to drink water frequently. My mouth becomes dry and I have to drink frequently. After 1.5 hours, I have to have some sip of water, not full glasses. He says he's easily fatigued, easily in the evening especially. Suppose he goes out for a work in the evening, when he comes back, he feels, oh, I have done too much work now today. I'll take a total rest. Tomorrow morning, I'll do the remaining work. There is a weight gain from last 6 to 7 years because he's in middle age now. Now skin has got dryness where there is itching specifically at night. Hmm. And sometimes he gets scratches while shaving on the beard also. The wounds heal, but they take such a long time. This was also observed. He said, sir, पहले ये 2-3 दिन में ठीक होता था. Now it takes 8 to 10 days. But ये heal होता है, he told me. Also, he likes sweets. Being Maharashtrians usually eat more sweets, is my observation. And like for cold, he is very sensitive to cold. Like he'll wear the sweater first when he goes in cold room, or suppose somebody puts on AC, or like he's sensitive cold. So there is an intolerance for cold. Mental and emotional things, he has got anxiety about his health. Now father was diabetic, so he's got anxiety कि यार मेरे को तो नहीं है ना. Now even so I asked him what will happen if you get. He said, sir, nahi, I saw my father complicating with all the disease, so I got fear of future complications, that the disease will complicate me. How is your nature? He said, sir, I am quite good, helpful, but I get angry when I am contradictory. Somebody in the meeting or when I contradict me, I get angry. Now, nowadays he complains that there is little bit sluggishness, slowness in his all readings and writings and doing work, and his concentration is also poor. We asked him his physical generals, where he said that his thermally we found him chilly, appetite was increased, sweat was profuse, sleep was unfreshing. He desires sweets, carbohydrates, and damp, we saw just now. So we saw his blood reports where the fasting sugar was 188. Huh. Postprandial sugars were 258 and his HbA1c was 9.2, which gives you a rough idea about 3 months of his sugar controls in the body. Desired value is up to 7. Acceptable. Below 6 is more acceptable. HbA1c. So he was 9.2. So it was alarming. He may have some complications because of his type 2. Lipid profiles, I may just said you like he had 320 of triglycerides, where 160 to 200 are acceptable, but he had raised. Where in a company checking, he got his grade 1 fatty liver also found. So we did a miasmatic analysis. This we should write down in our case paper. This is nowhere available. Miasmatic analysis. Okay. Some people do miasmatic repolarization also, which also helps in chronic cases from the symptoms. But this analysis we should do. Now the diagnosis, I mean, miasmatic was sauropsychotic because some psoric symptoms and some psychotic symptoms, where we saw that the psychotic symptoms were predominating. Previously, we saw what are the psychotic symptoms. Now, observations at miasm we'll see. Obesity, fatty liver, this is psychosis, which is predominant, which we have seen metabolic excess. Here has got easily fatigue, itching, functional derangement, they go into favor of psora. Now, no tissue destruction in the body was seen. So we diagnosed him miasmatically as a psychotic constitution. So in his totality, this constitution should count to give him better, or you can say good results. So the totality which we talk was obesity, slow metabolism, profuse perspiration, chilly, craving sweets, and all fatty liver. So calcarea carbonicum came leading. So we gave him that calcarea carbonicum. I'll give a small justification. It's a calcarea carb is given for synoptic metabolic disorders. We saw obesity and sluggishness, profuse sweating, chilly constipation, and craving for sweets. So this was the justification for selecting calcarea carb. So, and even hot remedies had also come, but they all got eliminated because of its tendency to catch cold easily. So prescription was Calcarea as a single dose. Never load the patient 200 TDS for 1 week and 15 days. It is over medication and it is over pressurizing the vital force in our body. So we gave him placebo for 15 days. Dietary advice was strictly given, daily walk and diet constitution. Now we continued with the conventional medicines initially, no sudden withdrawal. Never do this mistake. People on conventional medicine ask us, sir, वो बंद कर दो क्या? Never do that. In initial state, to trigger the vital force and to get it to normal, we have to continue the conventional. And once the patient responds, you have to come to little less, and slowly go on reducing the conventional medicines. Never make a mistake of stopping all the medicines because it amounts to even medical legal problems for us. Follow up after 6 weeks. Thirst and urination was reduced, means the frequency was reduced. He had got good energy levels, skin itching reduced, and even the fasting PP came to quite settle inside. 102, 180 still. They are high, but they came. Mentally also, like he said that now I'm feeling fresh. Now my sluggishness has gone, even I can recall small things, not totally, but small. So the remedy was repeated only after the symptoms relapsed. If any of the old symptoms relapse, then only remedy has to be given or lifestyle modification is to be continued. So prognosis and learning points from this case. What we saw, type 2 DM is manageable, not merely suppressible. You should not suppress it with conventional treatments. Constitutional plus anti-myasthenic approach gives us a sustainable result. Blood sugars, they improve secondarily to vital correction. They do not improve immediately. Yeah? By giving a single dose, the sugar 400 came to 120, never happens. Slowly they come down, give some time. And long-term follow-up is essential. Rapidly, I'll go through a case 2 now. This is a case of a female of 39 years old. She was a homemaker. She was overweight with puffy appearance. Family history, the mother was diabetic, and the duration was around 3 to 4 years. Now, chief complaints were, as usual, soric treatment we saw, increased thirst and frequent urination. This is a soric symptom. Heaviness in the abdomen, persistent weight gain, because she was around 40 years old, so the hormone changes were going on. Recurrent skin eruptions, headaches sometimes, which were worse in the arm. Her mental side, she was sad, gloomy, and disposed to, depressions. Always she used to dwell on the past unpleasant events. ये मेरे साथ ऐसे हुआ था, वैसे हुआ था. She, in the irritable, she used to be in the morning time more irritable. She could not find out the cause. And being a homemaker, she was a little bit introvert, so she decided to be alone, not mixing people. Physical challenges were there. She was chilly, easily affected by cold. Appetite was moderate, but there was craving for sweets. Once a patient is diagnosed diabetic, he develops a craving for sweets. I don't know why. Is it a psychological or what? Also, I had a fried food. Thirst was increased. Perspiration was sticky and offensive. Damp rainy seasons used to aggravate her. And relief by dry weather and open air. I know the remedy by open air, your bias, so some other remedies come in your mind. We'll go ahead. Clinical findings were the fasting sugars 144 and 250 pp. HbA1c was 7.9, which was more than acceptable value, little bit. Lipids were triglycerides were raised and fatty to grade liver was observed. So we should also give importance to these things. Now, past was his history of recurrent leukorrhea treated repeatedly with suppressive medicines because she was 40 years old. The recurrent leukorrhea was dead and it was suppressed. So no major illness. Now, what was my miasmatic analysis? You should also write down on a paper after taking the full case, your observations and what miasms probably it belongs. See, obesity, fatty liver, and all the retentions of fat in the liver go in psychotic. That is a dominant miasm. Skin eruptions are SORA. So no tissue damage over there. So syphilis has no role in this case. So miasmatic diagnosis, I will tell you, was psychotic constitutional dyscrasia with soric admixture. Sometimes two miasms can come together. Characteristic symptoms and leading remedies leading to this remedy. What are the characteristic symptoms which lead to give me this remedy? Diabetes with fatty liver because of the miasms we could find out. Worse in damp wear, psychometabolic state, history of suppression, gloomy mental state. Final remedy was natrum sulf. Now, why natrum sulf? This is why will come to your mind. We saw that there are therapeutics, the spot medicines are there. Diabetes, this, give this. Diabetes with this, give that. We came to natrum sulf. It's a prime remedy for a psychotic miasm. We should study the miasm of the remedy also. Strong affinity for liver. We saw natrum sulf has got a lot for liver as well as pancreas. So liver pancreas axis is affected during the drug probing by giving natrum sulf. Dampness aggravation, fluid retention. So we gave natrum sulf 1 dose weekly into 3 weeks. So and placebo diet and counseling was done. Conventional anti-diabetics continued. Follow-up was that The reduced heaviness and bloating on skin eruptions were less. She improved really good. In her sugar levels also came down. In HbA1c trend to be improving. Now, what are the learning points in this case too? Natron sulfate is a key antipsychotic remedy in type 2 DM, especially indicated on fatty and damp aggravations. One should always address the root metabolic dyscrasia, not just hyperglycemia. Don't go on high sugars. Suppose somebody says, "Oh, my sugar is 400." Oh, the doctor is also having panic button. Don't do that. Other people do it. I have no objection for it. Organ involvement guides the selection of remedy. Which organ is affected? Is the kidneys affected? So this is long-term diabetes. If the initially it is affected, like you can say pancreas as well as the liver, we should say, then the antipsychotic remedy is needed. That is there. Now, teaching pulse, we can see what are from this case. Type 2 DM is psychotic and syphilitic. Psychosis dominates in this case. Now, treat the patient and not the sugar values. Always keep in the mind the sick person is important, not the sick symptoms. Modalities for organ affects are definitely important. Constitutional remedy gives lasting benefits for such patients because this symptomatology we have managed, but constitution is a must. Now, some rubrics I'll tell you. In diabetes, usually people see for a patient of diabetic in a family, they open commonly boric, they open complete repertory, they see this repertory, that repertory, and they get just messed up. Now, which rubric to see? So, these common rubrics for diabetes we can say in boric are diabetes mellitus. In urine, you can get sugars as one of the rubric. Thirst excessive, you can get. Emaciation with increased appetite, you can get a rubric. And weakness, where you have seen in diabetic patients, these rubrics can commonly be found. In BBCR, if you are using BBCR, I know many less people use BBCR. It is one of the good repertories. In the pathological journals, you can get diabetes, you can get glycosuria as a rubric, urination frequent you can get, thirst excessive also you can get. And in concomitants, you can say emaciation with polyuria, weakness with diabetes. This you can find it in BBCR. Complete repertory is very vast with good data and lots of recent collections. Even synthesis is in that. So there you can get in the generality chapter diabetes mellitus state rubric. You can get insulin dependent also, that is for type 1. Then diabetes management non-insulin dependence. This third one is for us. This you can get in type 2, where urine glucose increased is one remedy. Thirst extreme in diabetes is specially mentioned. Appetite increase especially in diabetes. Perspiration profuse especially in diabetics. So this is mentioned. So you can get a broad view for remedies in such places. And there are certain repertories also. I will not mention the author's name, but there is a diabetic repertory also, which I use usually. I have not taken the permission of the author, so I will not disclose the name. But it helps a lot in this practice to immediately refer in diabetic patients. Now, take home message for managing diabetes with homeopathy is diabetic is not just a disease of sugar, it is a disease of the person. We should keep in mind homeopathy treats the individual, not the glucose levels. We should address the root cause and the disturbed vital force by correcting the miasmatic background. That is very important. Homeopathy offers long-term sustainable control. Early interventions gives best results. The earlier the homeopathy, the better the pancreatic reserve. Or completely exhausted pancreas, they don't recover back. Complete pancreatic failure forever can occur, especially in insulin-dependent diabetics. There we have hardly any role. We have role, but hardly any role. Individualized remedy selection is a key for success. No single diabetic remedy fits all. Remember in mind. Constitutional and totally based on prescribing ensures a real healing. Homeopathy supports the organs. It does not suppress the symptoms. It helps to protect the pancreas and all the organs vital of our body. Lifestyle, diet, and remedy work together. Homeopathy usually complements dietetic discipline and a healthy living. Empowering by empowering the patients to take good control over their health. Diabetes can be managed safely, gently, and holistically. Homeopathy offers a non-toxic, patient-friendly, long-term approach without any organ damage. Our drugs never damage any organ of the body. It is not yet documented anywhere, so it's a safe science. Numbers improve when the person improves. Numbers means the high sugar levels. When the patient's vitality improves, blood sugar levels, they fall to the natural side. Homeopathy restores confidence and quality of life. Patients feel energetic. That is the first sign of recovery. Emotionally, they feel balanced after starting homeopathy, hopeful, and they are fears and dependency reduces down psychologically. So, friends, diabetes is manageable and offer reversible in early stages. Homeopathy gives patients a hope with scientific individualization and a clinical wisdom. Now, lastly, I'll come to a slide where my own observation from my 33 years of my practice. So all homeopaths, I will make a request that never give specifics for diabetics because they only suppress the symptoms and the disease continues and slowly it lands into target organ damaged. Mother tinctures, there is a habit of using mother tinctures in everyone. I know it. Gymnema sylvestri, Caesium jambolicum, but they have got a limited role. They are not dynamic. Keep one thing in mind. And in long term, they may disturb the vital force. Do not use here said remedies by bias. Today I told you about natrum sulph. So for all fatty liver patients, do not use natrum sulph. It is a here said and you may develop bias. So never do this. Individualization is a final answer to all to overcome and also lifestyle disorder with auxiliary measures. Individualization, auxiliary measures, and lifestyle, they all three-legged stool contribute to manage this diabetes. And miasm is a floor on which a patient remains permanently settled. So I hope the topic is very big, but I would like to just introduce you for any queries. Surely you can get me back. I am very much thankful to IFH team also for all the attendees who have patiently heard this topic today. And I'll be happy in future to have any interesting topic if sir allows. Thank you. Can I hand over to Dr. Dhanesh sir? Yeah.
Yes. Thank you, Dr. INDRANEEL. It's really an excellent session. And you really covered almost all part of this diabetes and how homeopathy can manage such situations.
Yeah.
Frankly.
Yeah. Thank you, sir. If any queries there, we can have one or two questions, or if it is time is up, we can definitely go to the other session. No problem.
Could you please share with us
what to share? Can you be clear?
And maybe your number, maybe. Maybe.
Okay.
That was then.
Okay.
Then.
I'll just type it over here. Yeah.
Yes. Maybe the number would also.
Probably number.
Yes, please.
Yeah, I've shared my number. You can WhatsApp me for any query. No problem.
Yes, we have given the number of the presenter in our poster itself. So those who are not having, not at registered with this IFPH group, please send your numbers to me so that we can add you in our group so that you will get the daily meeting schedule. I am inviting Dr. Sheila Prem to say a few comments on this. Yes.
Hi, sir. It was a wonderful section, sir. It is a great time with you. And you narrated it very clearly, especially the miasmatic management. Really, what we want to know also, because nowadays I think most of them are giving tinctures to reduce the blood sugar. We are not focusing to the miasmatic background. From learning from this, I think the beginners also or the fresh doctors also can learn from a lot of this to how to manage a diabetic type 2 case. Really, it is informative and it really motivates us to take more cases and give a perfect cure to the patients. Thank you so much, sir.
Thank you for your compliments. Yeah.
Yes, if anybody want to speak or have a question, please raise your hand. We have somewhat just 2 minutes remaining. If anybody want to talk, because diabetes is a big subject and we all know that. But at times, when people coming with the allopathic medicine, they used to take large doses of medicine, and at that time, when if you are not, you may not be able to get the right constitution or the correct situation, what is the real personality, then you can give some tinctures to just make the patient confident that homeopathy can do, and then gradually you will get to the real person inside, and then you can prescribe with the homeopathic medicine along with the allopathic medicine, and then gradually we can reduce the amount of medicine they are taking from the other side.
Very true, sir.
Yes. This is what I would like to add to the session, and you have mentioned this also in this way. Anyway, thank you, Dr. INDRANEEL BAWADEKAR, for coming out here and delivering such a beautiful session. Thank you, Dr. Sheila Prem, for moderating for the first time in this session. And you have done a wonderful job in the beginning to end. And we are thankful to those participants who attend the session. Hope all of you will join us tomorrow at the same time. Tomorrow we will have a session from Dr. Srinivasan, and he will be he is an expert in neuropathy, and he will be talking some points about neuropathy, how we can use this a tool for quick recovery and quick selection of the medicine. Thank you, Dr. Indraneel Bawadekar.
Thank you, sir. Thank you very
Thank
much.
you all.
Yeah,
Thank you so
yeah.
much.
Thank you, madam. Thanks to have you all together. Yeah.
Yes. Yes,
So,
thank
English session is over. Now we are handing over to the Malayalam session.